Good afternoon in South Africa, ladies and gentlemen. For those of you that are abroad, we just heard that it's 6 o'clock in the morning. So thank you for those who are getting up an extra maybe hour or two for joining this very exciting global cafe this afternoon. So I'm very honored to introduce um, Miss Nombulelo Zenani. And I must throw in, that it's in particular an honor for me because Nombulelo was my first master's student who graduated and went on to become a lecturer and leader in at her institution in interprofessional education. So Miss Zenani is an emerging scholar and senior lecturer at Northwest University. She's a published author, community developer, and research supervisor for masters in nursing students. Nombulelo has a background of being a professional nurse, a nurse manager, a leader or leading and development consultant, a manager in a renowned South African private hospital. She holds a master's degree in nursing education and a postgraduate diploma in health science management. She's currently enrolled for a PhD with a research interest in interprofessional education and interprofessional collaboration for quality and safe clinical services. A PhD looks into developing guidelines for a continuous professional development program aimed to enhance interprofessional competencies in the intensive care unit team in the Northwest Province in South Africa. Nombulelo believes in dismantling professional silos through strengthening interprofessional competencies in an undergraduate healthcare education and post-licensure, reinforces quality assurance in healthcare, and it should be a continuous discourse and mission to achieve. So with that, I would like to introduce Ms. Zenani, and the title of her presentation today is The Contribution of Interprofessional Education in Promoting Academic Success and Safe Practice in Undergraduate Nursing Training. So welcome, Ms. Zenani, and over to you.
Thank you so much, Dr. Filies. That introduction seems as if you're talking about someone else, not me. But thank you so much. I'm truly humbled, and thank you so much for the invite in me having to share insight on this manuscript, or in fact this article, this published article. It is a published article under BMC Nursing, so you're more than welcome to please read for the in-depth of the study as well as cite us as well. So the authors is myself, it's Professor Lepile Sebularo, who is a lifestyle disease director within Northwest University in the health science faculty, as well as Dr. Kgopolang Gauss, who is our simulation lab manager in the School of Nursing in Northwest University, as well as a postdoc fellow who is Dr. Precious Chukwere, who is also within our research entity. So there they are. The gentleman in yellow is Dr. Precious. The gentleman wearing the yellow shirt is Professor Lepile Soboralo, who is also acting as our mentor. And then the gentleman closer to me is Dr. Kgopolang, who's just going to graduate now in November. And then the lady who's wearing red is not a co-author, but he's also one of our colleagues, is Dr. Tenza, as well as Professor Sibularo. So this article came actually from a discussion that we're having in the Fundisa conference in 2021, and that's where it was conceptualized. And from there, we decided to partake in doing this review. But I want to say thank you so much to AfriPen for sponsoring and enabling this opportunity to me, as well as to our research entity under Professor Velma Luber, for creating a space for us to explore academic writing and also bringing forth evidence-based practice, as well as our director, Professor Mazibane. Thank you so much. So we'll look into why this research, and then I'll share a bit, but I won't go into details on the methodology, but I just want to share in detail the results and the discussion and the takeaways that people that are in attendance could consider to think about and even to include within the nursing curriculum. But before I actually going to do that, I want us to shift, imagine ourselves in a community setup, in a clinic. And our clinics are always busy. And in our clinic, we have Cindy. Cindy is a first-year nursing student. First-year nursing students, by this time, they probably know just the basic to collect vital signs or to do an admission, but they don't actually have a lot of pharmacology because that is trained later on in the duration of the year. And then you also have a doctor who's quite busy. And then you have Tandy, who is an enrolled nurse, but who also feels frustrated. So this is the scene. We'll call this clinic morning shift, a morning shift at Sunning Hill Clinic. So Cindy is excited because Klaus is a first-year student to start a clinical placement and eager to learn from the healthcare team. However, as the day progresses, he notices that amongst the team, there's a lot of tension in the team. So what exactly is causing the tension? Mrs. Moyo comes in, she arrives, she's a known hypertensive patient, and she's coming in with uncontrolled hypertension, and she's very anxious. And Cindy is the first person to assess her, but lacks clarity on the treatment plan because, of course, she is a first-year student. Dr. Nkosi, on the other side, is very much under pressure to see patients quickly, and she instructs Sipho to just go and start with the basic treatment without even adequately discussing Mrs. Moyo's psychosocial needs. And Cindy then tries to consult with Tandy about the potential medication interaction, but she also finds her busy and unapproachable. And he decides to proceed without anyone's input. Meanwhile, Lindiwe attempts to speak with Dr. Nkosi, but the patient's home situation, but he brushes her off, citing that it's busy. Look at the line. So in this case, you have a lot of distorted and fragmented care. We always talk about comprehensive care as healthcare professionals. And there's also a small, we can't actually say, a developing a nurse who actually isn't unable to actually communicate or voice out her concerns because there's doctors, there's seniors. How do you voice your concerns? How do you manage such situations? Because possibilities are the distorted miscommunication, the lack of understanding their roles and responsibility from the doctor. These all lead to an adverse event because we don't know what medication did Cindy or Sipho give to that patient. So that is how we could actually think this is something that is happening in a clinic right now. Right, as we're sitting, it could be happening in a very renowned private hospital, could be happening in a public hospital, but when there is ineffective interprofessional competencies, such instances happen. And the people that are affected mostly are the patient. So it came in that discussion. So if we look into healthcare, our healthcare is actually evolving. We have the climate change, we have the burden of diseases, and then all of these, they actually require us to look at innovative ways of how to give comprehensive care. And it's not something that is dependent on one profession. We need to understand that there is some level of interdependence that healthcare professional needs to have. And if there is interdependence, then it means that we can actually think that there will be interprofessional collaborative practices that are there. And if that is strengthened, then patient safety is strengthened and the clinical outcomes are also confirmed. But then we need to understand nurses are at the center of the interprofessional collaborative group or interprofessional professions because they form part of that team. And if they are early socialized into interprofessional competencies and them understanding the principles of interprofessional collaborative practices, they're able to posture themselves and they're able to demonstrate the outcomes of interprofessional collaboration. However, the problem comes in this is that in the developing countries, literature states that in the developing countries, interprofessional education inclusion, especially within nursing curricula, it's still in its infancy stage, meaning that the curriculum changes that have been happening robust in especially within the sub-Saharan nursing curriculums is that they have limited inclusion of interprofessional competencies being embedded into the curriculum. Just because pharmacy, nursing students, as well as biokinetics are doing one particular module does not necessarily mean that that is interprofessional education. Are they learning with, from, and about each other? Are they solving problems together, right? Are those skills structurally, are they taught by people who know IPE? Are those competencies structured? Are they facilitated effectively? Are they evaluated effectively? That's the thing. So this then leads to a limited insight on the skills, on the attributes of interprofessional competencies being demonstrated by the nurses. And we need to know, I need to highlight the fact that, as I repeat again, is that with the impact of diseases, especially the significant decline in the number of nursing professions, necessitate that the nursing profession needs to really look into including interprofessional collaborative practice for optimal care. And this lack of interprofessional education as well as interprofessional collaborative practices in principles being embedded in the nursing curriculum leads to chaotic, as we've seen in this scenario, a chaotic, unpredictable establishment, increased in adverse events that could lead to morbidity high as well as mortality rates being high, and also destructive power dynamics that could cause incivility amongst the healthcare professionals, and the strained communication between the interprofessional teams as well. These all, if we think about it, the patient is at the center, and at this time, the patient is the one that is suffering. So this study is then the first to serve to determine what could be the contribution of interprofessional nursing education in developing safe nursing care professionals as well as competent nursing care professionals in undergraduate. So in summary, we wanted to summarize, look into literature, summarize the contribution of interprofessional education in nursing education to developing competent as well as safe undergraduate nursing students. So we did that by doing an integrative literature review using Whitmore and Nauf, and with a great vision or with a great mission that if there are curriculum developers, nursing faculties, when you talk about nursing faculties, some actually say educators or researchers can look into this further on how can we integrate interprofessional education in the nursing curricula for such outcomes. So the steps is actually having 5 steps. So we have the problem identification, which I've clarified. We search for literature. We analyze using thematic data analysis. We interpreted the data, and then we presented the data in a narrative form. We ensured rigor by our way of analysis as well as interpretation to ensure that it's unbiased, and we also appraise the data. And that is the Prisma diagram. So when we looked into the results, 3 themes emerged So the first theme that emerged was promoting patient safety in nursing practice. And the second theme that emerged was socialize the nursing students in an interprofessional collaboration. And then the third one was promote or develop development of professional identity. So if we look into the first theme, we look into the first theme. It says it promotes patient safety in nursing practice. And how does it go about to do that? When we look into patient safety first, we need to understand that patient safety is a global concern all around, right? It's a global concern because of the high litigation cases that are there. And all these litigations or medical errors, they actually affect the well-being of the patients. There's a study that I checked, and then it actually stated that about 98,000 in a year you would find medical cases, and those medical cases could lead to death majority of the time. So there's 44 to 98,000 patients die each year due to medical errors. And these medical errors are not, you can't actually say it's nurses. We can't actually say it's doctors. We can't actually say it's pharmacists, right? It is linked to poor interprofessional collaborative practices. Are the people communicating with each other? Are they collaborating to actually provide a comprehensive care to the patient? What is linked? Why was the patient not diagnosed promptly? Why was this patient not necessarily seen that is a risk patient? So all of these lead back to interprofessional competencies as well as interprofessional collaborative practices. And so when you look into patient safety culture, how does then patient safety, how does interprofessional education influence patient safety? Is that it develops nursing students to actually be transparent about their work, and they adopt an effective interprofessional communication to provide patient care. So in essence, when we looked into the review, it actually stated that the IPE itself, when we embed IPE on this IPE or IPCP principles into students, they actually group the students to be open about collaborative. And when they are open to interprofessional collaborative practice, then there's correct diagnosis. Then there is continuous as well as timely feedback. Then there is also progress on patient status, as well as the treatment that the patient is being provided is efficient. And this limits then the adverse events occurrences. And furthermore, the students understand what team functionality is about. Then they are also able to interdepend on each other. When I say each other, they interdepend upon the professionals. Let me make an example. If our student is doing their third year, right, and they witness a patient with let's say hemorrhage, right? Postpartum hemorrhage, the student is able to not only rely on the nurse, but the student is able to actually see, oh, the blood loss is this much. Let me call perhaps the standing in gynecologist or the physician who is here to know if this patient needs to go to theater and so forth. It actually broadens up the students' understanding around also how to manage cases that are in that manner. That is what the review has also shown. Also, in this, the other theme was creating patient safety culture. And when we talk about patient safety culture, is that the student in this case, they build trust, they build respect, they also build judgment and awareness of other disciplines. Moreover, they are able to recognize the importance of team-based approach when handling medical problems, right? And all of these skills, they endorse the acquisition of teamwork skills, which is essential in patient safety. Because if we look into patient safety culture, are we able to prevent adverse events? Are we able to all contribute to a patient safety environment? Are we communicating enough? Because also you find that some of the times you would find that some nurses or even some medical doctors or even some pharmacists, they don't necessarily disclose adverse events when they happen. But if you create a culture of open communication and you also create a culture of interdependence, such adverse events, they are not actually seen punitive, because IPC breaks down the whole punitive culture in actually seeing how can we actually look into the problem, optimize on the problem and stuff to actually create patient safety to our patient. Right, and the second theme was training on teamwork strategies, right, for efficient diagnostics, as well as team-based treatment. And this can actually be done within the undergraduate students. So how then do we do this? So the study have shown that possibly include in the curricula, especially within teaching and learning, teachings or training such as the team strategy tools to enhance performance, as well as patient safety training, right? This could be included as a workshop, but it could be evaluated, right? And within teams training tools and enhancement of performance and patient safety, you have tools such as the SBAR, which is the background, what is the situation, assessing the patient and recommending of the patient. This could be good. Imagine if this could then be included in the nursing process, whereby the student know, okay, this is what is happening. If I'm going to be calling a doctor, I need to be able to know, this is the problem, this is the assessment that I've done, this is the recommendation, or I am requesting you to intervene. In that way, there's communication, there's team leadership, right, in that essence. And in essence, it actually improves quality of care as well to the patient. Another strategy that could be teamwork strategies could be quality improvement initiatives with a different interprofessional students in clinical practice. They can look into infection. What can we do as the different professional students in, so let's say, infection preventative control measures? Let's say if there are falls in the hospitals, how can we as the student try to close that gap, right? Of course, it will be evaluated or assessed by even the quality assurance person, or even the academic that are there to support the students. So these training strategies, they actually reinforce teamwork, role clarification, also the interdependence and communication amongst the nursing students as well as other professions. And the other sub-theme was patient-centered care. That is what interprofessional education does, right? It promotes nursing students to provide patient-centered care given to sharing of the knowledge that occurs across the discipline. And also the care that is given to the patient, it's not fragmented, it's not task-orientated, but it's well coordinated within the IP team, which is planned by the team, designed by the team, implemented by the team, as well as evaluated by the team as well. So this team approach then ensures that even patient, it's not only beneficial for the patient, it's also beneficial even for the hospitals or the institutions in terms of the decrease in length of stay, which actually ultimately decreases the capita in per stay. All right. And when we look into the team two looked into socializing nursing students to effective interprofessional collaboration. Because if we don't necessarily include interprofessional education within the curricula, the students won't necessarily know how to collaborate with the other interprofessional team. So in this essence, the students are able, this particular theme highlights how IPE can promote students to have clear, accurate communication with other professionals, and also how not to operate in silos. They will also know the different perspective of other professions. And also they're able to critically think, clinically reason, solve problems within a team, right setting, and this actually promotes teamwork. And at the end, the person who's at the center is the patient, and the patient is the one that is going to benefit. And when we look into the theme itself further in the theme is that if we include interprofessional education within the nursing curricula, is that it will develop ethics. Because we always say that even if a student is technically competent, right, he can do the skill, but if the student does not have the ethics, the values, and the student is not culturally sensitive, not only to the patient, but to the colleagues, it's prone that there would be quite a lot of power dynamics. It's prone that there would be quite a lot of errors that are there. So in this case, if we are doing interprofessional education early on and socialize the student early on, the students develop sound ethics, not that they don't have, but they are more culturally sensitive to listen, to actively listen and respect the opinions of others. So this also encourages positive consultations within the interprofessional theme, and then it also then promotes patient care by addressing if there's going to be transitions of care concerning a patient, then this can be done in a team-based approach, which is actually something that we always talk about when we talk about comprehensive care. Moreover, if we are also able to let the students to learn with other healthcare professions, with, from, and about each other, they're able to handle conflict. Conflict is not seen like something to shy away from, but they're able to actually learn from each other how to handle conflict within a team, right? Call positively at that essence, because conflict is not a bad thing, right? Conflict is not necessarily a bad thing. And if we are able to actually make them to learn how to work with each other, how to even handle conflict in pre-licensure, the possibilities of them being able to handle conflict post-licensure are even better. And the person who's being benefiting at the end is the patient. Also, the experiential learning opportunities in managing real life, because if we, for instance, use one of the studies have also shown that if we use interprofessional simulation training, for instance, the students would learn team communication, teamwork, collaborative problem solving, right? And this experiential learning will help them to solve real life problems, right? They learn it in a control area because the patient is not there. When they go out in the clinical setup, they're able to also then do it quite well. And this, if we actually do it, it essentially hinders stereotypes. It essentially breaks that I'm a nurse, or I'm a doctor, I'm higher than you, or out of discrimination among the nurses and other healthcare professionals. And these things, if they are not controlled quite well, they cause animosity. And at the end, they actually affect what we call the psychological environment of the healthcare establishment, whereby people just want to go because psychologically, one, there's a lot of power dynamics. One sees themselves as higher, but we don't actually see each other as a team. So interprofessional education comes in to actually break that silo and say, we can actually all be in a team and be for the benefit of the patient, and create a good psychological environment where there's no people that are leaving because of the animosity that is within the psychological environment. Furthermore, it also has shown that IPE training programs within undergraduate nursing avails an opportunity for understanding how other professionals approach patient care. And also it shows how can you then assist them for the priority of ensuring quality of care. And this positive learning experience then increase what we call cultural competence, because as different as we are, we then understand each other. We talk about concepts such as cultural sensitivity, cultural competence, and teamwork. This is what IPE does. And the last thing was actually promoting professional identity. When we talk about professional identity, we talk about me as a professional nurse, understanding the values, the behaviors, the attitude, the culture, the skills, and also associating myself with those, right? And within interprofessional education, it's not that we are saying that nurses need to break away from their identity as nurses. No, it mainly means how do I integrate my nursing profession within the different professions? How do we integrate it for the best of the patient? So the students in this case, they are provided an awareness, promote self-awareness. How do you promote self-awareness? They're able to see new options. They're able to speak up respectively, not only for the patients, but also for themselves. They also value their practice and they value their profession and understanding the value of the profession within an interprofessional team. Moreover, they will also understand when working as a team together with the other professions, they understand their limitation and they're able to share their learning experience with other healthcare professionals. They're able to identify where can I improve, where can I deepen my comprehension through this team-based discussion or collaboration. In essence, they are also able to fully being able to experience their capabilities as unique and of value within the team, not as a minority, not as a subordinate, but also as a part of the team. Also, it assists with reflective practices, something that we also as professionals needs to have. For me to be able to reflect and change my perspective and realization of how learning experience is allowed and also in real life situation within a team-based approach. And also you move from having not necessarily a professional identity, but you also are able to identify your profession within a wider interprofessional group. That is what the review has shown. It broadens the profession or the nurse's ideas of what profession identity is about beyond the nursing profession. And it also assists them to not resist in having interprofessional collaboration just because you want to maintain your professional identity. You do maintain, you're not losing it. However, you're seeing the value within a bigger group, and that is what interprofessional identity is about. So in essence, if then this is not happening, the interprofessional identity is not developed, and it can be beautifully developed through integration of interprofessional education, is that the professional identity will isolate and limit both your abilities to understand about other professionals and then about other opportunities to train and also to be efficient with part of a team. And if it's done well, structured, facilitated well, and also evaluated well, it's easy for us, not easy to, it's a process, but it's a process that will start to break these professional silos for a more interprofessional identity. So how then, what are the strategies? Question is, how then do we start off? What could be the strategies? I've mentioned some few. You will have your interprofessional based education, right? Whereby we have there's 5 essential elements of interprofessional simulations training. You will have your scope of practice and roles. You have realism matters. You have communication and teamwork. You have effective debriefing, as well as to foster learning space. So this will include, let's say, for instance, the cases, there would be case scenarios whereby you could have that have triggers that will necessarily will give to the students to do in practice, and then they will have to solve those scenarios together. But in essence, have a case scenario that speaks to everyone's role, and then have it in an interprofessional simulation training, and have probably a mixture of facilitators from the different representative of the students that are in attendance. In that way, the students are able to know their roles and responsibility. They're able to solve problems together. They're able to communicate and collaborate together in essence. Right, and I've mentioned earlier on having interprofessional quality improvement initiatives that could be driven either by the hospitals or the nursing educators. Lovely enough that you will have probably Dr. Gerard Filies is here. I've read that they have their own unit that is there having different types. Sometimes it'll be different to have all professions actually facilitating that, but having an interprofessional unit within a facility who actually facilitates these strategies or these programs could be more beneficial to the students because it's structured and it's evaluated timely. And also having interprofessional scholarly teaching and learning projects, it could be a start where scholars come together, they identify an interprofessional gap within the nursing practice, and then they actually develop these learning projects whereby they learn with, from, and about each other for the benefit of either the students or the patients if they want to do community engagements. And you'll also have vital training workshops that actually include different types of healthcare professionals. They would learn topics such as goal of care conversation. I know this is more particular within ICU, as well as end-of-life discussion within an IP team. All of these, they just assist the students on how to posture themselves when they go into practice to have this discussion in real life. Also, you would find things such as interprofessional team-based learning approach. It's something that really needs faculty development, and it also needs people to be trained around it. Could be very beneficial to the students to learn. And in recommendation, I would say that if there are curriculum developers or educators here, is to really advocate and starting gradually. You have the different 4 probably competencies or 6 domains of the competencies, gradually have them embedded within the curriculum and then have them assessed. And then as the people progresses, then you add on more competencies and have structures, IPE curriculum models that are there and frameworks that could be used to include so that it's clear and it's efficient on how can we actually integrate these IPE approaches and also ensure that it's IPE assessment approaches. Because as I said, it does not serve purpose for us to have one module. We're saying we're learning about the world, come together, professional nurses, and then there's a nurse or a nurse educator or a psychologist or a pharmacist who's standing there to teach about this one particular. That is not IPE, right? Are they learning with or with each other? Are they sharing their expertise? Are they solving real life problems, right? This could be done in a community-based learning where they solve real life problems, right? That is interprofessional education. So faculty development on IPE could be very essential so that it benefits the students and the patient. Also, regulatory bodies can also define how to articulate, the articulation of IPE is in the curriculums. Also, if there would be changes in the curriculum, let them have or include interprofessional education within the curriculum as well. So in conclusion, the study serves as a foundation, and I hope there's a lot of people that are listening to see and also to remember the situation we had with Cindy, who feels that his voice is not heard, who does not know how to handle power dynamics, who wasn't clear about the roles as well as responsibility, the teamwork that is distorted. Our essence should be, if we allow that to happen, are we not then agreeing that the patient should be compromised? Because that's the essence of what we're doing if we shy away from including interprofessional education. The benefits outweighs the challenge, right? The faculties or the schools that don't have such units, such as the IPE units within their university, there's room to benchmark, there's room to contribute, there's a room to call whoever got it right to ask, how have you done it right, and how can we do it best for our students? It sets the nursing students to a better position themselves in the interprofessional team. without being timid or without being engulfed into fear. It gives them courage, it gives them confidence, it gives them more posture in terms of professional identity. Nursing students becomes confident, they value their profession even more within a team to provide safe and quality care, not only to the patients, but to the community. And it can be started in small, right? Just in small, where we just include some of these strategies that I've mentioned. Thank you, Dr. Filies.
Thank you so much, Nombulelo, for a very comprehensive presentation. I realized when you started speaking that maybe I was very excited to introduce you. I didn't tell people who I am, but I'm Gerard Filies, and thank you for promoting AfriPen. I am the chair of AfriPen. But we'd like to open the floor now for any comments or questions. You can just raise your hand. We've got Tony with a hand up. You can go ahead,
Yeah.
Tony.
Outstanding presentation. Thank you for all the work you're doing. I think you really hit on a good, that socialization is really such a key component to interprofessional education. One of the things that we've noticed in the United States is our students' ability to communicate since COVID has been challenged. I think there's kind of a combination of a hesitancy on kind of face-to-face interaction. At the same time, there's a increased level of agency around, like, I can kind of do what I want to do. Have you noticed that with your students at all?
With our students, it varies because you do have students that are very assertive. We have a group of the new millennial students are very assertive from what I picked up. They are able to speak out their mind, but it's also a matter of how do we then position them to actually speak their mind in a structured way. So yes, they are able to stand up, but again, it's a matter of personality, because you do have those students that are smart, that knows or identify that this patient will probably, let's say this patient will go into a cardiac arrest. I could see something is happening there, or this patient or this treatment can be done in a certain way. They know this insight because we teach them, but however, they feel like, but I'm just a nursing student, right? So it's still, you always have to reinforce it by saying, please trust that you know this. But again, it's not structurally taught to the student. And you can't actually tap on something that has no one actually planted a seed in saying this is how you communicate or so forth. So I think in ours, it depends on the personality of the student. But again, it's not something we can say we're leaving it like that, because what about that student that is smart, that knows what can happen to the student, to the patient? How do we put that student in a better place of communicating with the other interprofessional team?
Thank you.
Thank you, Nombulelo. Tony, you happy with that?
Yep, thank you.
100%. Then we have another hand up. Alison, you can go ahead and unmute.
Thank you very much. Yeah, that was a great presentation. I love the way you started it. It held our interest straight from the start. So thank you so much. And I wanted to comment. It was an observation, really, because I always talk about how important it is for our students to show respect to interprofessional colleagues. But I love the way that you sort of framed that in interdependence. So that point of don't just respect them, you need them. And I really like that. I know it probably seems really straightforward to you, and you've always talked in those terms, but I just haven't heard it framed that way before. And I really like that, and I'm going to really take it on board. So thank you for that. And also, interestingly, with integrating it into nursing curricula within my university, I'm the IPE lead. Nursing students, the numbers outweigh every other professional program. So you've said to introduce it gently, if you like. How do how do you make it so it's authentic learning, given that you've probably got 10 to 1 nursing to other students? What top tips have you got, please?
I read, for just to make it known that I've read quite a lot of what the University of the Western Cape Prof. Filies is doing within their department, is that they will have it, when I say gently, I mean, we can't necessarily teach all the competencies at one go. You still want to actually see that they know about it. I think the first module is around primary healthcare, if I'm not mistaken, Dr. Filies, and they all learn about a specific, what I love is that, and also that is what I'm also finding out from my own PhD studies, that it's not necessarily saying we're learning IPE competency. We're learning about a certain topic together. Yeah. And in this certain topic, we're learning about primary health care. But the essence of it all, the competency that we are tending to is communication. So you need to be able to know, how do I actively listen? How do I actively share information? How do I actively communicate and all of that stuff? So then you progress to teamwork. And then you progress to roles and responsibility. Roles and responsibility, ethics, and then roles and responsibility, and then teamwork, and then managing team dynamics and so forth. And that is how, and in that process, you are able to evaluate it as well. Is it working? From the student's perspective, what did you learn? And from that student perspective, in terms of the feedback that they will give, you would see, oh, now they've learned communication. There's a bit of role evaluation that is learned. And then as you go, you progress or you add on what they have learned. But in essence, have a topic that is familiar to all of them that they can learn.
Thank you so much. Thank you.
Thank you, Alison, for that question. Anyone else on the floor that has a question? If you're having problems with audio, you can also put it in the chat, and I can read from the chat. Any questions? Just maybe while we're waiting for people, Nombulelo,
Yes,
you mentioned something about the evolving healthcare system. And when you were talking about that, I couldn't help but think about, in South Africa, our government, our president just signed the National Health Insurance Act. And I was just wondering, I know it wasn't part of the review, but just your thoughts around how that's going to change our healthcare system. And even now, more than ever, there's a need for interprofessional education to be integrated into the curriculum. But just what are your thoughts around the NHI and how our health system will change?
It will change drastically, and probably for the good for some people. But then the question is the health sector, especially within us, because remember, we have the private sector and the public sector on our end. Question is, how prepared are we? How prepared are we in terms of infrastructure? How prepared are we in terms of the resources? How prepared are we in terms of managing even disasters, for that matter? Right? We have the climate change that happened right now, that is happening. How prepared are we in all of these essence? Because if one thing happened, and that is COVID, COVID has shown that our infrastructure is not well prepared. So question is, yes, it's for the good of the public, but has the groundwork for preparation has been done? Right, to ensure that it's actually quality healthcare that is going to be provided. How realistic as well can we anticipate that the outcomes could be? I think there's a lot that needs to be ironed out, and also interprofessional collaborative practices come together, whereby those different minds come together and say, here's this big vision. It's big, it's beautiful, it will care for everybody, but how do we make it realistic? Because how do we make it realistic? How do we make it to have impact in society? Because now it's only in paper, but question is, how prepared are we in terms of the resources within our country? I'm scared. I have to say there's a bit of me that's scared. There's a bit of me that's excited for people that needs the initiative, but I'm scared in terms of will our infrastructure and the resources that are there in health system be able to carry all of this expectation?
Okay, thank you so much for your thoughts. I think those are good insights in terms of, how prepared we will be. And we will see within the next few years how that will unfold.
Yeah.
Okay. I'm just checking again from the floor. Is there anyone else with a question or comment?
I just want to make a comment on behalf of Interprofessional.global. We truly thank you for your time and your insightful presentation. We greatly appreciate you taking the time to do this because it really was helpful. This will be, the recording of this will be posted on YouTube and also on the Interprofessional.global website.
Thank you, Tony.
Thank you, Tony, for having me.
So, colleagues, I am mindful of the time. I don't see any other questions. I just want to say from my side, also on behalf of AfriPen, we want to thank Nombulelo for putting this presentation together and for sharing this research with us. As she said, it is a published paper, so you can access this paper if you want further information. But thank you so much for sharing your research with us. And we look forward to how this will be integrated within your nursing program at your university. Watch this space.
Can't wait.
It was an absolute pleasure listening to you. And we just wish you well for further research and with your PhD. And
you
thank
so
you, colleagues, for tuning in. I know we are all very busy, but thank you for your presence. It was really appreciated, and we wish you well with the rest of your day.
Thank you.
Thank
Thank you
you.
so much.